to the registrar of the Uganda Medical and Dental Practitioners Council, where the committee expressed interest hearing from the council after the interns tabled their petition to the speaker through the member of parliament from Mukono on 1st October. And the issues they raised, that they are being affected by the shifting in the policy of training, inadequate supervision, difficult working conditions, lack of equipment, long working hours. And so the purpose was to invite the council with the specialists to advise Parliament on what should be decided on. Then in their petition, it has many issues. They talk about having formed a federation. I think there is freedom of association, so people can federate. And they gave a background on the health workforce. But then they raised issues which may not be directly in the docket of the council, but you can talk about them as senior doctors. Accommodation, remuneration, and then they talked about the rotation policy. They talked about the pharmacists who are not being supervised. And then there are a few other issues on the nurses. But also, when we shall be concluding, we shall talk about also the Uganda Medical and Dental Practitioners Act, the act that establishes the council. And we review and see whether the council is actually doing its job. And if it isn't, in the presence of the minister, they advise us on how we can help to facilitate the council to do its duties. So I think in summary, that's why we are here. We apologize we have started late. Usually members come late.
Accommodation allowance has been incorporated into the monthly allowances given to the interns. However, as long as, in terms of long-term strategy, Ministry of Health will allocate additional funds in the next 3 financial years to enable the training centers to construct more accommodation for interns. Mr. Chair, you are aware there is capital development for each regional referral hospital to the tune of 1 billion. And as a ministry, we're now planning to ensure that that money is put in to construct an accommodation facility for the interns, at least for the next 3 years, such that we do away with this at the regional referral hospitals. Supervision of interns. Currently, there are 39. Previously, we have 36. Now there are 39 internship training centers, which include the public, private, not-for-profit, and private health practitioners' health facilities. The medical interns are deployed in these training centers depending on the availability of supervisors. The interns are supervised according to the following arrangement. 1, each internship training center will assign a staff as an internship coordinator within the institution. 2, each training center should have at least 2 supervisors per discipline, supported by additional mentors as necessary. 3, each supervisor should be able to supervise not more than 4 interns per rotation. The supervisor should have an advanced qualification in terms of degree of fellowship in the relevant area of supervision. And lastly, intern supervisors may be paid a monthly allowance to be determined by Ministry of Public Service. Mr. Chair, currently there is a gap of 219 clinical specialists and 600 support cadres at all the facilities, national and regional hospitals. The 2015 Human Resource for Health audit indicates that the vacant posts for consultants and senior consultants in the national and regional referral hospital in the country stands at 61%, while the gap for the specialized cadre is at 83%. In addition to that, the infrastructure for the health facilities is constricted, and these structures should be reviewed with the support from Ministry of Public Service. Even if the current positions are filled, the human resource availability will still be inadequate to serve the increasing population in the country. When we come to the medical internship policy, Chair and members, by the Ministry of Health in consultation with all stakeholders, it was presented at all levels of approval of the Ministry of Health, which included a presentation was made to the Hospital and Health Infrastructure Technical Working Group. It was presented to Senior Management Committee, Health Policy Advisory Committee, top management and senior top of Ministry of Health. The policy was posted and submitted to Ministry of Finance, Planning, Economic Development, and a certificate of financial implication was obtained. The regulatory impact assessment was done and a cabinet memo was written. The policy, the regulatory impact assessment, and a certificate of financial implication was then submitted to the Parliamentary Secretariat for discussion. It was at this point, Mr. Chair, that the Parliamentary Secretary informed the Ministry of Health that the way the regulatory impact assessment was done was wrong. It has actually changed this time. So, the Ministry of Health officials will now have to meet with the Cabinet Secretariat to come up with a new regulatory impact assessment before the document is submitted to Cabinet and it is prepared in Cabinet memo for discussion. Every time we come to this committee, more than twice, we have raised the issue of gaps in terms of having consultants and senior consultants at those training sites. Indeed, it is true, the last financial year, as you said, that allocations have been, money has been allocated for wage, but it was not realized, has gone over 15 billion meant for wage, went back to the Treasury. I want to say it is true that we work hand in hand with the Health Service Commission in terms of recruitment of the senior cadre, when to advertise, when to get them, and to put them on board. But number two, you realize in the couple of years, much as adverts are put in place, the seniors were not picking up the position. Why? Because there was disparity in salary scale between Ministry of Health staff and Ministry of Education in terms of seniority, in terms of the different level. However, this financial year, it has been harmonized, but we are hoping that it will improve such that the senior people will come over to the Ministry of Health. Otherwise, because of that significant salary discrepancy, we did not realize many senior people to come to the Ministry of Health.
But the President came out recently. Final page.
Chair have read.
Should be shall.
It is should be shall because we have to commit.
But you chose your words correctly.
I apologize for that. The word should be read. Each supervisor shall be able to supervise not more than 4 interns per rotation.
Yes, I want to understand one more thing here under welfare.
All the undergraduates, they finish. They go through their councils. And when the council has clarified or has cleared them, then they come for deployment with the Ministry of Health. So we always deploy all the interns, all the prospective interns who come. And once you have deployed them, it is a number that determines how many we should deploy. But for budgeting purposes, the Ministry of Finance say the money that we have can only accommodate 1,000 medical interns. And that's why in our document we say they gave us only 11,430 million. But because the number always keep increasing, that's why we deployed all the other interns which came for deployment. It is a force coming from outside which determine now what we have deployed.
I think it's maybe you never got your answer very clearly. Yeah.
Put some 3 zeros.
So there is a correction there, the deficit is 2 billion. The fund will be used for payment of allowances, induction trainings, support supervision, and for meetings. Chair, allow me to take you through the issue of accommodation for interns. The medical interns raised concern over inadequate accommodation in some training centers. And I would like to clarify that until the late 1990s, medical training internship was only for medical doctors and for dental surgeons, and the number was manageable. It is usually less than 300 in total. That was way back in 1990s. Now the internship training sites, by then we will have provided accommodation and meals for the interns. Since that time, a number of other cadres of health workers have joined the internship training program. We've got the graduate nurse. And in addition, many new medical schools have come up to release over 1,000 graduates per year, and all those required internship training. The hospitals that provide internship training are limited in numbers, in terms of infrastructure, capacity, equipment, and currently they are actually overwhelmed with the numbers that are being deployed. And it has been submitted for approval. However, as I said above, the whole scenario has changed. 2, the Ministry of Health is currently discussing with the Ministry of Finance and the Ministry of Education and Sports the best way to comfortably handle the big numbers of the medical interns, on of which this country needs all those doctors. The last one, Mr. Chair, the Uganda Medical Internship Committee will carry regional induction training for all the medical interns in order to orient them on the internship training that was meant for October. And I believe this is just a typing error. So, Mr. Chair, I thank you and I beg to submit.
So I know what goes on. And I know that if you don't handle the interns properly, the public is at a very big risk. You heard from what Dr. puts there is the tip of an iceberg. These interns, when they are in the facility, they are the ones who are really handling the patients. The supervisor is there just to see whether they are doing it right or not. If they are not doing it right, the supervisor will correct the person. The problem is that now we don't have supervisors. So these interns are groping in the dark. They don't know what they are doing. I'm a specialist in diabetes. One time I went to Mulago. After my retirement, I had a patient. We went to casualty. There was a patient on the bed there with ketoacidosis in a coma because of diabetes. This intern saw me enter and he ran and said, "Doctor, thank you. Please come and help me." The person was dying. The intern didn't know at all where to start from. Why? Medical school training has a problem. You will find that the whole training, that person who is an intern has had one lecture in diabetes and has never worked on the diabetic group. So he doesn't know. So the longer this person stays around, the more chance that they will get a diabetic on that group. And then the patient will survive, especially if there is a supervisor to help this intern. So anyway, the problem is very complicated. We are trying to solve the issues at the end of it, trying to force the intern to improve, to understand, to know what they are doing. But during our trainings, we entered the wards when we knew it all, because the teachers were there. All along, wherever you would turn, you even walk from one ward to another, you'll find there somebody to teach you. These teachers are no longer there. They are not there. We don't understand why recruitment has not been taking place over the years. I finished my work, as a doctor in Morocco. I should have trained so many others to emulate me, but they are not able to train. So the problem is very complicated. And if we don't address this issue one after another, I don't know what the future is doing. Because we who knew what to do have all moved out. The few we trained who are still there are also soon going to move out.
They are very
Yes. So we are looking at you, the legislators, to help us to set things right before it is too late. But the public is dying because of these poorly trained doctors. Because, the medicine is a process of acquiring skill and the arts over the years. And I always tell the young doctors that learning doesn't stop. That even at this age, I am still learning something. By the way, I'm also retired, but I still practice. Now, I can't overemphasize the point of mentorship and getting a one-to-one attachment with these young interns. I know when I was still active, I would ask them a simple thing like listening to the baby's heart. And they would tell you, this is the first time I'm hearing the baby's heart. Then you ask them, what were you recording? They would tell you, baby alive and well, you deliver dead baby. You said, what were you listening to? So they may be running away from, working for so many years or so many months in a discipline, but I think we should not be twisted by the law. The guidelines are there. You were asking about guidelines, but they were blocked by interns. So we have agreed to be cajoled by interns to do what they want. And yet, we are in the firing line. I really fear to be sick. Right now I'm sick, but don't worry. I fear to be a patient because you don't know what they are going to do to you. Now, talk of ethics. You may end up coming for an operation and you end up without your kidney. Don't worry, that is a by the way. You come for you come to deliver and I go away with your kidney. Is that ethics? I give you a baby and I pay myself a kidney. We are living in an environment where there are so many players who are coming out. And we are looking at money. Look at remuneration. They say we don't have money. So why can't they find unethical ways of paying themselves plus doing a bit of your work, whether they do it badly or well, I don't know. But we've reached a point, I think, where people are not coming with medicine as a calling, and we have to mentor them, change their attitude, and make sure they treat the population. They have the people at heart, and people who are treating that heart. So I think as we talk through all these, remember you are the consumer. All of us are consumers of these products. They are going to treat you. And what you get out now, you will not blame anybody if you don't do this thing right. Thank you.
And certain things were done. When it was so fundamental that we needed recruitment of certain number of
We don't have a good tracking system for internship training, and the causes are many. Some include the movement of interns from one site to another, because one site might not have all. In some countries, when you go to a site, you complete your internship, and we know you are in Soroti, you are there, and we expect you to come back. But sometimes now they have to come and you have to transfer to Lacho or Kabale, and so the tracking is not very good there. Mr. Chairman, as you have seen, we have indiscipline among some interns. Another issue is that we have not done good evaluation on the product, on the process and the product of the interns we have. The second issue, as a challenge, is capacity for internship training. We have 31 accredited internship centers which have limited capacity to handle big numbers. Total is 36, but those which we use as medical and dental are 31. The rest are used by nurses and whatever. But they are not enough for the big numbers. Mr. Chairman, you'd want to know that in the past we have been having an average of 250 doctors graduating, but now we are having 550, 600 per year, and the facilities have remained the same. So most of the centers are inadequately equipped in terms of equipment and supplies for internship training. Mr. Chairman, if you allow, we shall circulate later what we found at each of the committees. We can give you. Okay. Mr. Chairman, we found the inadequate, the internship centers are inadequately equipped in terms of equipment and supplies, which are really necessary for internship training. And we also found that, as I said earlier, that most of the centers lack the required number of interns. Would want 2 supervisors per discipline per site. So we would expect 8. But you find in one of the areas like Kalong, there's only surgery. So you have to shift people from there when they finish surgery to go to another site. The number of interns is big and increasing due to the new schools which are starting. It is a challenge. It's not a problem, but it's a challenge. Funding internship. As the number of interns is increasing, the budget has not been increased to the same extent. So as a result, you have seen a lot of strikes arising out of poor pay of the interns. What the ministry does, what is available is what is divided among the interns. And of course, the supervisors whom we have talked about, they are not given any allowance. Okay? It's only Mulago which was doing, but the others are not. Mr. Chairman, the poor pay for interns is a very big problem because it brings issues of illegal charging and some other issues. Now, the recommendations. Ministry of Education and Sports, the number and quality of students entering training institutions, including foreign training. We have been having challenges, Mr. Chairman, of arguing with the National Council and the universities which numbers each university should have. Of recent, now we have an MOU, but in the past it has been a very big problem that universities just admit to balance their budgets. So you find the university doesn't have capacity to train a certain number, but there are so many students, they don't have enough teachers, they don't have enough equipment, and enough space even to sit. However, there's an issue of foreign trained doctors, because we also found that some students go outside when they didn't have capacity to do medicine. And when they come back to do exams with us, we have been having a challenge. You saw in the newspaper some time back that people are failing. The chairperson for the examination board is here, Dr. Nambia. People are failing more than 4 times above the guidelines, and we fail to know what to do with those students. In some countries, they have put some mark which people should have even if they are going to train outside. No, we don't. No. Okay, the second recommend. Okay, Minister of Health should equip internship sites. This one we have already talked about. This include equipment, infrastructure, accommodation, and the report is available on that matter about the shortages of that. Minister of Health should lobby for more funding for internship training. Mr. Chairman, that funding, when they allocate money to the internship course, it is divided amongst all the interns who are there. So it is not specific. Now, there are two problems with that. The people who have now finished internship, especially those who are coming from outside, the ministry decided, because of the limited budget, to have only one intake of internship. So if you came when the internship has commenced, you have to wait for another year, just because we don't have enough money. Another through the National Council and professional councils should enforce the implementation of curricula. Yes, this has been a weakness which we want to work upon, because some universities lack teachers, or if they have teachers, they are not available for teaching, so the curriculum is not being implemented very properly. Minister of Education and Sports should establish a national examination board for medical and dental graduates. Mr. Chairman, this is the way forward now. The Americans are doing that. UK is doing that. South Africa has started that. The objective of this is that we shall harmonize the people we are having as graduates now. At the moment, if you are studying in University X, people think that you are really substandard, and you really have to fight to prove yourself that you are really a good doctor. That is one. The second thing, supervision of these universities is not easy for the regulators, because in the universities, we have models in the universities who tell us what is going wrong. But unfortunately, sometimes the models tell the person. So when they tell you that there is no surgeon in Iguru, when you go there, you find a surgeon has been placed there, okay? And you go back and you tick them. But actually, that person is actually not there. So you spend a lot of time going to some of the university, we go there 4 times a year to verify some issues. But if you set up this exam, the university will also be given a responsibility back to make sure that they have the teachers, they have the equipment that are required, and both we all have the same people who are respected and safe for us to work. We also want to, Mr. Chairman, to do a study, because now there's this argument that universities X are producing substandard, but you can't do that one without a study. We are going to do together with the National Council to see if that is true. We want, Mr. Chairman, to maintain the 6-to-6 system, which is one of the complaints that the interns have, and the specialists who are much more senior to us will explain. But the experience has shown that medicine is becoming very specialized, and when people move there, they don't cover all the areas in the 3 months. So the seniors saw that the previous system was much more better than what we have at the moment. And the people who were produced then are the people who have learned the system up to this time. So that's why it was reverted, and we want it to be maintained. And we really don't want to buy the idea of interns directing what they are going to be taught. Otherwise it will defeat the purpose. Even in the universities now, people will say, I don't want commercial law because I want to do something else. Now we also, there's a need to decongest internship centers. And this one we can do, Mr. Chairman, if there is capacity for us to open up general hospitals, because there are specialists there in the posts. They are there, but we cannot attract them easily, but the posts are there. If they are opened up, we can open much more internship centers, and then we can decongest. The Kenyans have done that one. They have 1,000 interns, doctors. They have been able, because all the general hospitals have become intensive centers, they have the specialists there. So if we could have money to recruit and attract people, then we can decongest. Mr. Chairman, we want the first approval of the internship guideline. We are having a problem with the court because we've been going there. The interns are always shifting goals. So that is a very big challenge to us, that we cannot implement internship. And we are here lagging behind the East African community. This next year, actually, the East African community wants to inspect the internship guidelines. But the requirement would be that all the guidelines have been integrated together, but we don't have at the moment. But all the same, they will come. We request, Mr. Chairman, to amend the legal framework to facilitate the recommended facilitation interventions we are talking about. We are talking about the setting up of the exam, national board to do exams. We did an inquiry. The background, Mr. Chairman, is that the challenges with the graduates is not only in Uganda, it is the East African problem, and it's also an African problem. So, in East African community level, it was agreed that we do an East African joint exam for medical and dental graduates. But they gave each country leverage to go and consult how it can be done. And we are given the limelight to do that. So we started, and we came up with a document. Unfortunately, it's among those the interns blocked in Parliament. But the Tanzanians came. Blocked in court. They blocked it in court. The Tanzanians came and got our document and made a law. For them, they are starting the exam this year. So we really want to be supported in that. Related to the legal framework we are talking about, my chairman, we talk about the National Health Professional Council, a council which is going to bring us together. We did the consultation in 2014, and we finished the document. However, on the way, we got blockages by some professionals, especially the pharmacists, and we couldn't go forward. Now the ministry is trying to assist us, and we could ask you, Mr. Chairman, to assist in that so that we have that one done. We finished the documents. The Kenyans who came here for verification got our document. They have an authority before us when we finished in 2014. Okay, last but not least, reconsider the placement of, reconsider, this one I can jump. And also, last, Mr. Chairman, we need to know which cadres should we do internship, because at the moment, everybody is clamoring for internship. There's a cadre of clinical officers who have now come up, who are doing degrees, they want internship. Even some lab people and whatever. So there are some of the recommendations that we gave the interministerial committee, but we are also presenting them here for your consideration. I submit.
Yes, I think
what Dr. Katumba has presented covers both the background to internship training and the current status of internship training, the challenges that we are having and how to address them. And as I said, the issue of internship training is not new, and the struggle to try to improve internship training is an ongoing process. But we need a lot of support in, what is that town called?
Busia.
In Busia. There is what is called no man's land. And that is where the term border started from. That you move from one side to the other using a border. So internship training is like using a border to move you from a student who has just graduated into becoming a medical professional. So it's a very important area of training, which sometimes is misunderstood and therefore is not given much support. We and the Medical Council will not register anybody to become a medical practitioner unless he has done internship. And this is a worldwide requirement. That whenever you go to whatever country, if you want to be registered there, they're going to ask for two things. One, your graduation certificate, and two, your internship completion certificate. So we take this as a very serious area of training, and we need every support to support these people so that they can join the profession. I just wanted to add that so that it can give you a flavor of discussions that we want to have. I'll hand over to the Minister.